Hello everyone, I'm Dr. Gulhima Arora, Senior Consultant Dermatologist, Mehekta Gul Derma Clinic, New Delhi. And today we're going to talk about hair fall in women and its remedies. This video is going to entail what the multifaceted condition about hair fall entails and what the causes and triggers can be. It will also include how you can address this common condition and what hair care tips must be taken to avoid excessive hair fall. So let's dive into the journey of discovery and recovery to manage and address your hair fall issues. Hair fall is also known as telogen effluvium, which can be acute if it is present for under 6 weeks or chronic if it extends beyond 6 weeks. It affects both the genders, but it is slightly more addressed in females because they are more concerned about the aesthetic of hair in them and tend to take treatment faster. Telogen effluvium occurs because the hair growth cycle does not go back into the growth phase or anagen phase. So the hair follicles which are supposed to get back into the growing phase after the resting and shedding phase do not get back into it, and there is continuous shedding which is known as telogen effluvium. This is a multifaceted condition with many causes. The causes can range from hormonal imbalances like a thyroid issue. It may be due to excessive inflammation or infection of the scalp. It could be due to nutritional deficiencies like deficiencies of B12 or iron or even vitamin D or even an autoimmune condition. So it is best to consult a dermatologist to know the cause. Next, we must understand there are a lot of triggers that can also give rise to this condition. Stress, I would say, is a number one condition. Other triggers could be a major stress factor on the body in the past 4 to 6 months, like a major surgery or a major illness. It could also be due to certain hair care practices that one undertakes, like going to parlors and getting keratin treatments or overuse of styling and heating on the hair. Lifestyle is an important trigger as well. Lack of sleep, crash dieting, dietary fads, and of course, as already mentioned, stress is a very important trigger. So what are the remedies to tackle this? Up at first, one must understand that it's only hair fall and it is something that is usually settled once the trigger or the cause is treated. So there's no need to stress about it because that would further increase the hair fall. It is also important to understand that a correct diagnosis is important by a dermatologist because what may seem as a banal hair fall may actually be something a little more serious. One must understand there is a 3D holistic approach to treatment and lifestyle changes must be done to address this condition. Relaxation techniques and yoga play a very important part to calm the mind and do away with stress. An adequate 7 to 9 hours of sleep and intake of a balanced diet are equally important. If there is a cause, your dermatologist would probably write out a blood work for you and get some investigations done to rule out a cause and then treat the cause appropriately. Hairstyling and hair care tips are important. One mustn't comb out wet hair. It is important to use sulfate-free shampoos which are gentler on the hair. And it's also equal to make sure that your hair is well hydrated with a good conditioner. Cut down those styling gels. And if you're using heat, don't forget to keep moving your hair dryer, keep it at a distance of 6 to 8 inches and use a hair protective serum. Avoid parlor activities too frequently. There are a lot of remedies for telogen effluvium, But I would suggest, as a dermatologist, avoid the DIY, especially applying onion juice or garlic juice directly on your scalp, because once the follicles get damaged permanently, there is no way you can grow the hair out of them. So, your dermatologist, once you consult him or her, is going to prescribe certain medical treatments and maybe some oral supplements, which could get back the hair into the growing phase from the shedding phase. I hope this has given you an overview of hair fall and it's been of use to you. And if you find this video helpful, please log on to dermavidya.com and get more insights into the condition. Thank you.
For more such videos, visit or log into dermavidya.com.